Okay, so now I'm going to talk about another important communication skill for an OSCE type exam, or the MRCGP SCA, for example, a consultation and communication skills exam. In most cases, as well as communication and consultation skills, they'll be looking at the clinical content of what you're doing, data gathering. Are you taking a safe, concise, effective history? Are you excluding the relevant red flags? Can you work out what the diagnosis is? Do you know how to manage it? Okay. And so in terms of the data gathering, one of the things that's really important is know what you want to ask and ask what you want to know. What do I mean by that? Well, you need to consolidate your clinical knowledge so that you know what are the relevant risk factors for different things, what are the different differentials for a patient presenting with a certain symptom, and what are the questions that are going to help you narrow down those differentials into one or two things. But you also, by having good knowledge, you'll know what you want to ask, but also ask what you want to know. What do I mean by that? Don't be afraid of, at the appropriate time, asking specific questions that are going to help you narrow down your differentials, or if you want to rule out specific risks. I'll give you a really good example. Because one of the things is, if you don't ask specific focus questions, you might run out of time and not be able to discuss your diagnosis, your management plan, and therefore lose marks in the management domain. So I'll give you an example. You've got a patient who you're worried if there might be a safeguarding concern. Maybe a young patient, they're requesting contraception, and because they're underage, one of the things you want to assess is there any risk here in terms of safeguarding? Is this one of those situations where GMC guidance would suggest that I should be discussing this potential risks and sexual activity with the safeguarding team? So a really important question would be to know, how old is this person that they're potentially going to have intercourse with? Do they hold a position of responsibility? Like, for example, if it was a teacher, you'd be worried, right? And so sometimes what people will do is, instead of asking specific questions, like how old are they? And could you tell me what they do for a job? And then, for example, if you want to see things like, are they potentially trying to groom them in some way? Are they trying to offer them drugs or alcohol? Rather than asking, did they offer to buy you a drink? Did they offer you any drugs? People will ask a really vague question. So let's say you've got a 15-year-old patient and they've asked for contraception. You've assessed that they're GLIC competent. They meet the Fraser guidelines. So, you now want to look at, are there any safeguarding concerns? Imagine someone that, instead of asking what they want to know, they asked a more vague question and they said, all right, so this person that you're thinking of having a physical relationship with, could you tell me a bit more about them? You see, very vague. What do you think? Remember, the simulators are trained to respond in a way that would be appropriate for the patient they're playing. So in this case, how do you think a 15-year-old patient might respond to that question? Oh, he's really handsome. And he's got blue eyes, and I love his haircut. And what I really like about him, he's very tall, because I'm quite tall. And a lot of boys my own age, they're too short. And I don't know, I just like taller men. And anyway, the other thing is, he really talks to me in a nice way, he's respectful. Like, again, boys at school, they just use bad language, they're immature. I don't like. Now, all this is very interesting, but you've got 12 minutes in the SCA for the whole thing, not just for the history. And if you spend 4 or 5 minutes finding out this guy's hair color and how tall he is and his shoe size, you're going to run out of time, because if there is a safeguarding issue, you have to have that discussion that you're going to have to discuss this with the safeguarding team, because you have a duty to protect them, but also to look at other things. Okay, you need to at some point also assess, is it safe to prescribe the pill for them? So looking at the clinical parts of safety. Is there family history of things like breast cancer? Is there family history of stroke? Checking the other risks that they might have, like are they a smoker, for example? You see, your time that you've got in your consultation is for all of it. So one of the ways to make effective use of that time is to know what you want to ask by having good clinical knowledge, and then ask what you want to know. Don't be scared to be direct. It's going to help you be more focused in your data gathering, and then that will give you time to deal with your management. Hope that's helpful. Do subscribe and follow if you want to catch the next video in this series.